you recording it?
Yes.
Okay. So I'm just going to go through this on purpose, just for recap. The principles of doing a physical assessment on any patient. In this particular instance, it's an infant. We will start the physical assessment working from top to toes. So cordio, cephalocordial. And then we will work from inside out, so it's mediolateral, and then we work systematically. So systematically, the objective of working systematically is to make sure that we assess every system in the baby's body, every physiologic system in the baby's body, but also to have a routine in our physical assessment and not do a physical assessment haphazardly. Okay. Then also the tools that you need to do a physical assessment is a clean, soft area for the baby to lie on, like this one. You need your thermometer, your stethoscope, and you need a thermometer. You will need a pen, and you will need the baby's road to health card, and you can also have a page or the patient's file or something where you make your notes during the physical assessment, like when you find something abnormal or when you do a head circumference. Just send me the measuring tape as well. So when you do a head circumference as well, okay. Although you know what, Glenn, I'm not gonna do. I'll send it. Let's. But I'm actually not gonna do it. I'll say when it must be done. Okay, so let's just stay with the physical assessment for now. Part of the tools that you will need is yourself, your senses. Okay, so you need your eyes to observe the entire baby all at once. You observe for any abnormalities, any rash, and you use your eyes to develop instinct about what is going on with your baby. And everything that you observe on your baby, you always base it back to demographic history taking that you have already done with your parent and baby, and you also refer it back to the physical history taking that you have already done with the parent or the caregiver and the baby. Okay, then you need your own ears. And what is it that you listen to? You listen to the interaction between the mother and the baby. You listen to the baby's breathing. You hear, just by normal having the baby lying on the mother's lap or in her arms, does the baby have difficulty in breathing? Okay, you can also just listen with your ears if the baby has any difficulty in breathing, so lung sounds, wheezing. You will also use your stethoscope to auscultate the lungs, and you will also auscultate the tummy. So your ears is very important. Then your nose is very important, your nose and your mouth. So you as a healthcare provider must also provide care for yourself. So keep yourself hydrated. Always have something to drink, water preferably, so that your mouth is moist and your mucous membranes are moist, so that your nostrils are nicely moisturized as well. And what you do have to do in your assessment with your nose, you smell for any foreign or offensive fragrances. That is any fragrances in the ears of the baby, the nose of the baby, the entire baby, the baby's clothes, or anything. You might smell smoke on the baby's clothes, and then you can refer it back to demographic history taking. Okay, and that will then indicate your health education that you will give to the mother, to the caregiver. And you always give health education in a non-judgmental way, always, okay, but in a very gentle and authentic way. So that's why you need to be in tune with your family that sits in front of you. And then the last sense or tool that you have, you are born with that, is your tactile sense, and that's your hands. These are your gifts from God, okay? And you will use your hands to touch the baby in a firm but gentle way, and whilst touching, you process what it is that you are touching. You feel for lumps, swelling, edema, rash. Feel if the skin is warm, cold, is it dry, Is it a coarse skin? Is it clammy? Is it feverish? Anything like that. So all of those tools that you as a healthcare provider need, you are born with it. You already have it, and that's why you are here. Okay, so when you come in and you start to assess the baby, your assessment wouldn't have started just with the baby in front of you on the assessment bed. Your assessment would have started with the mother coming into your consultation room, the family or the caregiver, then sitting down and that interaction, and you would have already observed any movement and behavior in the baby. Okay, then when it is time for the mother to bring the baby to you, firstly, I want to show you, always when you handle a baby, bring the baby close to you like this. Let me take my stethoscope off now. Okay, so always bring the baby close to your body like this on purpose, because it has a neurological benefit for the baby's brain. Okay, take the baby from the mother, and then you tell her, you invite the caregiver to come and stand with you while you do the physical assessment or when you plan. Then what you do is make sure that the room is nice and warm and comfortable. There must not be a direct light in the baby's eyes the way this light is now. So this light is too bright for this baby. If the light could have come from the sides, it would have been very good. Okay, but this is what we have, and I am making a shadow. I am also going to use, I'm making a shadow with my own body in front of the baby's face to protect the baby's eyes. Okay, but when I do get to eye assessment, I'm actually going to move away quickly to see if the baby is doing something. So I'll tell you that. Okay, also remember that a baby, especially a newborn baby, was in the womb in a fetal position. So when you leave the baby open like this, they feel very insecure. They're going to move around and they're going to start crying, and it is going to make your assessment more difficult. Okay, I wanted to go through this form, and I don't think we did it the way we wanted, but we'll go through and I'll discuss it afterwards. Okay, so our baby is lying here now, so let's start with the physical assessment. Remember, top to toe, inside out, systematic. Okay, and what I'll do while I do the assessment, I store the information in my mind, everything regarding this baby. But when I go and sit down and record, I'll record according to each physiologic system. Okay, so so and then in handling the baby, so try and keep the baby in a fetal position. So hold the hands close to the body of the baby, and then you can take the baby's hat off. Nice and gentle. Maybe the baby is still waking up, or maybe he is alert. And look at the baby's eyes already. Okay, but I am at the head now. So, but I'm also looking at the eyes, because I want to see if this baby is making eye contact. Is he sleepy? Is he too sleepy? Or is he crying? Okay, so calmly observe, and you start. So now I let go of the arms in a gentle way. Okay, I can keep my one hand on the baby's body and with my other hand palpate, or I can use my arms to stabilize the baby, and this is my natural way of doing a physical assessment. So I take the baby's head and I palpate. And what do I palpate for? So this is the neurological system that I'm starting with now. I'm palpating for the anterior fontanelle. I feel if there is any overlapping of the skull bones, which would be expected after a normal birth. I feel for the posterior fontanelle. So the posterior fontanelle is usually quite low on the head, and it feels like a little dimple. Okay, and it's very small, and if your hands are not experienced, you won't be able to palpate it. But feel if you can feel that little dimple, and feel the sutures, and come to the front, and you'll feel the anterior fontanelle feeling diamond shape. Okay, it mustn't be bulging, it mustn't be sunken in, so you want to feel for a soft one. If it's sunken in, record it, and link it with other things that you will start to see. Okay, then I still have my baby in front of me, and my hands over the baby's head, and I feel behind the baby's ear. So can you see how quickly you start to move into the next system? Okay, I feel the ears, I feel behind the ears for any lumps. I look at the baby's ears to see if they are bilaterally present, bilaterally positioned, and if they are patent, okay? And then whilst I'm doing this assessment, so I'm actually still with neurological system, I do my motor reflex. So what you do is, you just hold the baby's head forward like this and let go, okay? And then you will see the arms going, okay? So just show, and then I just say, it's all right, you are doing so well. And then I tell the mother, wow, but you have a clever baby, because this motor reflex shows intact brain and extremity neurological system, okay? I would also try and talk to the baby and see if he turns his head to the side where I'm talking, okay? And then if I can't get that now, that reaction from the baby, then I ask the mother, do you think your baby is hearing when you talk to your baby? So it's an interaction between the caregiver, the healthcare provider, and the baby. Okay, I look at the eyes, which I would have done now already. The baby would have opened the eyes, and when the eyes are open, I look at the eyeball, the eyelid. I look for edema on the eyes, and I look at the pupil of the eye, but I don't go and force it open, okay? If it's a newborn baby, the face will still be edematous, so you will not be able to see the inside of the eyes, okay? Because the eyes are edematous. But I want to see at this moment that both eyes are present, that the eyelids are present and moving, because there might be paralysis, unilateral paralysis because of a birth injury. So we look at that. Then I'm going to move away for that light, and the baby's blinking. Even though the eyes are closed, they will blink. So, good, I'm happy. And I tell the mother, oh, just see how clever your baby is. Okay, look at the nose, see if both nostrils are open and patent. You can hear. If you don't hear abnormal nose breathing sounds, there's nothing to worry about. Then it means everything is fine. But the moment you hear a snorking, like, okay, it means that there is something blocking the nose inside. And then you ask the mother, is your baby having difficulty to feed? And then she'll say, yeah, it doesn't want to breastfeed. It keeps on pulling away. And then put that information back to demographic history taking and physical history taking, because there might be some cause for this blocked, congested nose, okay? In the meantime, I also still look at the baby's skin on the cheeks. I look at the back of the head, because the baby might have, so now I'm on skin, which is part of senses, sorry. And I look for seborrheic eczema, any eczema, maybe the baby has vernix still on the skin, whatever. Then I move down and I look at the neck, okay? And what is going on with the skin, which is part of number 2, which is the senses, to see if there is any rash or moist or any concern regarding the skin under the chin. And remember that a baby's neck is just this short, okay? So you have to open and see. Also, what happens when the babies feed, the milk run and it lies under the chin and in the neck, and then the babies do develop a rash in the neck. But the neck is also part of musculoskeletal, okay? So what I'll do is, now only I will start to undress my baby, because I'm trying to expose my baby as little as possible to the environment temperature, okay? And whilst I'm undressing the baby, I'm doing my physical assessment. So what am I looking at? I'm looking here at muscle tone, which forms part of number 8 musculoskeletal system, but I'm still working from top to bottom, also inside out. So you can't really isolate any of these systems like I indicated here. It's just on this form I'm indicating you need to incorporate all of that, okay? So I'm at the neck. I look at bilateral position of the shoulders, go to the arms, this stage. So now I'm at the arms, I'm at the hands, I'm looking at a grab reflex, which forms part of neurological system. But I'm also on